Welcome dear students, let us have a quick revision of the glycogen storage diseases, GSDs. As the name indicates, these diseases, they are due to abnormal accumulation of the glycogen in the liver and muscle cells and very rarely in the heart and kidney cells. Glycogen, that is the stored form of the carbohydrates in the human body. These diseases, they occur due to the enzyme deficiencies, and these enzymes are very important in breakdown of the glycogen in liver and muscle cells, a process called as glycogenolysis. And when there will be abnormal or less breakdown of the glycogen, then that glycogen will get stored in the liver and muscle cells in abnormal amount, and that can lead to the glycogen storage diseases. And the enzyme deficiencies are due to the mutation in the genes. So all glycogen storage diseases are the genetic disorders, and they run through the families, and they are the inherited disorders. There are currently 19 types of the glycogen storage diseases, and few are very serious disorders, and currently there is no cure for any glycogen storage disease. The only solution for the patient is to maintain the normal blood glucose level by taking the diet which is rich in carbohydrates. My dear students, out of 19 types, these are the 6 most important types of the glycogen storage diseases. First is the von Gierke's disease, also called as glycogen storage disease type 1. It is due to the deficiency of glycogen glucose 6-phosphatase, and when the glucose 6-phosphatase is not in its proper amount, then the glycogen gets stored in the kidney and liver cells. My dear students, this disease is usually diagnosed in the first year of the patient, and the signs and symptoms include constant hunger. The patient always feels eagerness to eat something, nosebleeds, gout, fatigue, stunted growth, puffy cheeks, thin chest and limbs, swollen belly. So these are the signs and symptoms in this disease, and the patients usually they do not survive. And my dear students, the patients with GST type 1, they should avoid taking milk and fruits because they do not have the enzyme to break the sugar which is present in the milk and fruits. The second one is the Pompe's disease, also called as glycogen storage disease type 2. It is due to deficiency of the enzyme acid maltase, and the glycogen is stored in the liver and muscle cells. If the Pompe's disease is diagnosed in the first few months after birth, that is called as the classical infantile onset. In that case, the patient has weak muscles, mean myopathy. It will be suffering from hypotonia, that is the poor muscle tone, and enlarged liver hepatomegaly, and usually due to heart failure, the patient cannot survive but just a few months in his life. And if it appears at age 1, then that is called as non-classic infantile onset. In that case, the patient has poor motor skills like the crawling and sitting, and there is cardiomegaly in the patient, but there is no chance of the heart failure. But due to respiratory failure, the patient cannot survive but up to his childhood. Then, in case of late onset, there is no chance of respiratory or heart failure, but there will be delayed puberty and adolescence, and the patient usually they survive in case of the late onset of the Pompe's disease. My dear students, the third one is Cori's disease, glycogen storage disease type 3. It is due to the deficiency of glycogen debranching enzyme, and the glycogen gets stored in the heart and liver cells. The signs and symptoms include enlarged liver, that is hepatomegaly, and sometimes it leads to the chronic liver disease, that is the liver cirrhosis, the muscle weakness, the short stature, but there is no heart failure in this disease, so patient can survive, and it is also called as the Forbes disease. The next one is the Anderson's disease, also called as the glycogen storage type 4 disease. It is due to the deficiency of glycogen branching enzyme, and the glycogen gets stored in the heart and liver cells. And my dear students, the signs and symptoms they include the hepatosplenomegaly, liver cirrhosis, and muscle weakness. And my dear students, in this type of the disease, the glycogen is stored in its abnormal form, that is called as the amylopectin, and there is only single therapy possible for this disease, and that is the enzyme replacement therapy. In all these cases, the permanent cure can be the genetic, so that the gene mutations may be corrected, then that will lead to the proper production of the enzymes in the body. Or the second case is basically the enzyme replacement therapy, that you can replace the enzyme to meet up its deficiency. Then there is McArdles syndrome, which is called as Glycogen Storage Disease 5. It appears at the age of 15, and it is due to the deficiency of the myophosphorylase or the muscle phosphorylase, and the glycogen is majorly stored in the muscle cells, due to which there are some signs and symptoms. First of all, the person cannot perform the hard exercise, and if a person is involved in a very intensive activity, then there is brownish red urine after activity. There will be fatigue, there will be muscle cramping, there will be muscle pain, and it is due to the decreased production of the lactic acid in the muscles, due to which the muscle pain after the exercise, that is a common symptom in the patients of this glycogen storage disease type 5. Then last one is the HERS disease, which is glycogen storage disease 6 type, and it is due to the deficiency of liver phosphorylase, and obviously due to deficiency of the liver phosphorylase, the glycogen gets accumulated in the liver cells, due to which there will be enlarged liver, hepatomegaly, then there will be greater concentration of ketones in the blood, that is the ketosis. There will be slow growth, but the height will be normal. And my dear students, in this case specifically, the functioning of the liver cells that gets disturbed. So these are the different types of the glycogen storage diseases, which are just due to the enzyme deficiencies because of the gene mutations, and then the glycogenolysis, the breakdown of the glycogen gets affected, due to which the glycogen gets stored in the body in the abnormal amounts, that leads to the glycogen storage diseases. So it was all about the glycogen storage diseases. We have just conducted a quick revision of these diseases. Otherwise, the concept of the diseases, that is very vast. I hope so that this lecture will be useful for you people. In case you find any problem, you can ask in the comment section. Till then, take care.